We're going to talk about employment and marketing. Here it is. There it is. That's the whole presentation. That's it. Hire slow, fire fast. How many people have had to fire an employee? Yeah, it's amazing, right? How many people have found what I found, which is there's a 3-in-1 rule. You hire 3, you keep 1. It's amazing, right? It's the way it is. And it seems anywhere. When I'm in California, it's the same thing. Florida, it's the same thing. We hope, somebody looks us in the eye, tells us something, shakes our hand. They're being completely honest and completely transparent, and they've got a professional license, so obviously it's accurate and it's great. Am I right? That's what you figure. True or not true? Yeah. So, but it turns out it's not true. That's not how it is. So that's the nature of it. You will never get to a point where everybody that you hire, you keep. It's never going to happen. What you can do is you can reduce your risks somewhat. What can you do? Background checks are a must, especially in important roles. And I'm not just talking clinical. I'm talking about key operational, key business roles. If you have a chief financial officer that you haven't background checked, shame on you. If you have a COO or a CEO that you haven't background checked, shame on you. It's not expensive. It doesn't take a long time. It has to be done. Anybody that's patient facing, background check them, because last thing you want is them going to their car every 15 minutes to have some really interesting activity going on in there. You need to find out. Drug testing, how many people drug test? Beautiful, beautiful. That's so important. A lot of people figure, well, I'm only going to do it, I've got a workers' comp policy with a drug-free workplace policy. No. Background check, drug test, please. It's simple. It's now standard in the industry. And quite frankly, what are you going to think when somebody says, I'm not okay with you doing background check or a drug check? Exactly, that. I like that. That's good. It's very Italian. I like that. That's very Italian. You're dead to me. Anyway, so really important to do. Some people go a little further. They'll do an MPRE. They'll do a psych testing, and they'll look for compatibility that way, which is cool. It's like eHarmony met the psych testing world. Not a bad thing to do. I have clients that do it. This is a great risk-reducing thing, and it's a great employee retention thing. Better match, spend more time on the front end, measure twice, 3 times, and then cut once. There's some resource for you if you don't have a hiring background check company. All right, I want to talk about Florida. I know some of you are not Florida. Florida is what's called an at-will state. That means you're working because the employer said you could. So that when the employer says you can't, you got to go. It's that simple. California is at the other end of the spectrum. You have a reasonable cause requirement. You have to document things in a particular way, and that's fine. We know because we provide these services and help people in all states. But I can tell you, Florida is at the easy end of the spectrum. It's an at-will state. So letting somebody go without cause means you're letting them go for no reason. And contracts typically have 2 kinds of termination provisions: for cause, specific reasons mentioned, or without cause. In a state like Florida, you're always going to push the without cause termination button. Why? Because if you do that, you don't get claims for retaliatory discharge or wrongful termination. That's why we do it that way. Terminate without cause, meaning for no given reason, and then you avoid, you mostly avoid, any kind of liability for wrongful termination or retaliatory discharge. It is a cost-saving move. Terminate without cause. Which means don't make any exceptions in your contract for terminating without cause, because terminating without cause is going to be the only way you'll do it. What's a classic one? Non-compete. Non-compete is a classic one where we see people who say, I got a non-compete. I really got to protect my business. I put a lot of time and money into it, and you're a key guy, and I got to protect me from you competing with me. But if I terminate you without cause, you get to go across the street and steal all my customers. The problem with that is you're always going to terminate without cause because you don't want the liability associated with terminating wrongful termination or retaliatory discharge. That's a lot of money in legal fees. It's money for settlement. You don't want that. It's a bad day. With me so far? Cool. Let's talk about restrictive covenants a little bit. Yes, ma'am.
Are you saying that you can't have an non-compete and terminate without cause? Are you saying
Question is, can we have a non-compete and still terminate without cause? The answer is you sure can in Florida as long as it's worded properly. And in fact, my point is that non-competes, I'm a big fan of non-competes when I represent the employer. And when I'm representing an employee, I understand there are certain exceptions that make sense, but not a lot. Not a lot, because the employer, the business owner, is putting a bunch of money, time, resources into their business. If you're an important person there, that employer has to protect the business from somebody like you stealing patients, stealing things, and competing across the street. That said, termination is going to be done without cause, and you might look as an employee for exceptions to that, which we can talk about offline because most of you are employers. Yeah, Florida, non-compete. Has anybody ever heard the statement that non-competes are not enforceable? Okay, great. In Florida, they're totally enforceable. Totally enforceable. If the geographic scope and the durational scope, how long they are, and the circle around the business are reasonable. In Florida, 2 years or less in an employment situation is considered to be reasonable. In an ownership situation, it's not 2 years, it's 5 years or less is considered to be reasonable. So that if an owner leaves or is fired, you can restrict them for up to 5 years, and the court is going to say, seems reasonable to me. It's presumed to be reasonable. How about the geographic scope? Wherever you're getting patients, that's the circle. Define it, support it with data that you have, and then if you ever have to enforce the non-compete, you can go into court and you can say, here's my supporting documentation for why it's 10 miles or an entire county or an entire state. Non-competes are enforceable if they're written properly, and second part, if the employer didn't breach the agreement. If the employer breaches the agreement and tries to enforce a non-compete, a court is going to chuckle and then dismiss your case. Yes, sir.
What about if you have a partner that you're trying to separate from and usually likes to invest in different things, and you have not compete with that, you can't invest in another wellness company that competes against you with activities.
Yeah. The fact pattern is you got a partner and you got a non-compete. Non-compete says you can't invest in other competing businesses and you want to separate the partner. Enforceable? Yeah. 5-year duration? Enforceable up to that long. What's the geographic scope? Wherever the business is doing business, whatever the geography is. Yes, sir.
At what level does non-compete become unenforceable in the sense that I can understand a partner, I can understand a GEO, I can even understand a mid-level, to make it down to LPN, and then it's at what point, not proprietary, not a team in practice.
Yeah, at what point in a non-compete situation is the fact that somebody's not a significant position a factor in non-compete enforcement? It's actually the other way around. There's no protection for somebody that is rank and file in the business. None. The protection in Florida is you're doing something so super unique and needed that we can't restrict you. You're a pediatric neurosurgeon. Hard to enforce that. Hard to enforce it. Make sense? That's the only kind of exception that's in the statute currently in Florida. And by the way, this issue of non-compete, there's 50 different answers and they change every year. Why? State law. It's not a federal law issue, it's a state law issue. Changes all the time. W-2 versus 1099. One of my favorites, because people like to say, oh, everybody should be a W-2, or everybody should be a 1099. 1099 is the same thing for independent contractor. People like to oversimplify, paint with a very broad brush. If you're exercising direction, supervision, control over somebody, that, in the eyes of the IRS and the Department of Labor, that's a W-2 employee. You better treat them as a W-2, withhold taxes. Direction, supervision, control, that's a W-2 employee. There are other indications and other signs that that's a W-2 employee, like you're giving them paid vacation, you're giving them benefits, health insurance, 401k, all of those things are indicia, signs that that is, in the eyes of regulators, a W-2 employee. What's the job of regulators in this industry, on this issue of W-2 1099? What do you think their objective, prime objective, in pushing people from 1099 to W-2, which is usually the direction they push in? What's the primary driver for regulators in that space? God, it's genius, isn't it? It's genius. It's all about money. It's all about money. This is the driver. And the driver is always that direction. Try to get people to move from 1099 to W-2. You never see the Department of Labor or IRS say, you know what, we made a mistake. Really, what should happen is employers should pay less employer-related taxes. We're now sweetened. I don't know. I've never seen it go that way. It's always the other direction of we got to go get tax money. And dirty little secret, agents working in that space get advanced and promoted based on how much what? Fines. That's how they get advanced. That's how it works. So if you understand the winds in this industry are always blowing you from 1099 to W-2, then as a home health agency, when they changed the regulations and made all your aides W-2s, and it cost you a ton of money, they didn't blink an eye. They didn't blink an eye. And it happened in your industry, and it happens in nearly every healthcare industry out there. Temps, you're going, well, obviously less than 20 hours a week must be a 1099. Direction, supervision, control, benefits, paid time off, all of that stuff. That's when the IRS goes, aha, now we got some work to do. Because they're always going to try and push from 1099 to W-2. We're going to help you figure out whether that's a legit W-2 or a legit 1099. We're going to help you figure that out. Your accountant will also do that for you, by the way. So you don't just have to go to lawyers for that. And the same dynamics that we work with, they're working with. The realities of regulatory involvement and oversight, and that's the way it is. DOL, the Department of Labor, also looks at the issue of overtime versus folks that don't get overtime. Exempt versus non-exempt employees. Exempt people that can work 40 to 80 hours a week and only get paid their salary, tend to be owners and top-level C-level administrators and officers of the company. How about physicians? Sometimes. How about nurses? Sometimes. Chief nursing officers? Nurses that are working in a hydration clinic? Probably never, unless that person has some significant oversight in your business. Then there's an argument to push them into the exempt category so that you don't have to have them clock in, clock out. And by the way, there's a cottage industry in law, if you haven't been exposed to it. A ton of lawyers that apparently don't have a lot of work to do or just like the traffic of getting overtime cases. And they write letters, scare you, so you'll write a check, and they made their living. And that's what they do. It's a cottage industry. They're plaintiffs' lawyers in a very narrow field, and that's what they do. You need to be aware of that. There are two documents that you can live and die by. One is an employment agreement. That's the contract between you and that person. You have to adhere to it. You have to change it if it's not currently applicable. The other thing that people don't think about is your employee manual. Your employee manual is treated as a contract between you and your employees. So if you don't have one, maybe you're better off without one. But if you do have one, you have to make sure, does it apply to your current situation now? Because everything changes, right? You'll have a contract that you did 5 years ago, and the only time you ever look at them is when stuff goes bad, right? Well, you ought to be looking at them annually. Look at your contracts, ask yourself, is this current? Does it need to be changed? Look at your policies and procedures and your protocols, your rules, your regs. Look at them annually. Look at your employee manual. Look at it annually, because I bet there are changes. I mean, it's just normal for a business as it changes to learn things from employees and in your situation, and also certain things change, so you have to reflect that in the employment manual. Yes.
If you acquire another company, my understanding is there's a 90-day window, basically, and you can sort of free rein terminate without repercussion. Is that true?
It depends on the law in your state. In Florida, is it true? No, you should handle that in the purchase agreement. What you should do as a buyer of a company on the issue of letting people go that you don't like in the acquired company is you ought to be sitting down with the seller and making those decisions and pushing off the responsibility for firing people, giving notice and stuff, and complying with existing contracts and their existing employment manual. You should be pushing down that authority and responsibility to them prior to closing. Why take it on yourself as a buyer? Make sense? So you'll see that there are post-closing obligations. There are conditions to closing a deal like that. And that's where that topic needs to be addressed very specifically. We talked about terminating without cause. Let's talk about plan B. A lot of people, when they look at a termination scenario, they go, I can terminate you for no reason, or I can terminate you for a specific reason in the contract. There is something else, which is an alternative, which is let's make a deal. Also, I call it plan B. But the way it looks is, you know, you've got somebody who's not performing. This happens all the time. Their attitude is terrible. You got to let them go. You'd like to let them go for cause, because then you don't owe them anything and you can do it fast. But if you let them go for cause, as I said earlier, you expose yourself to a wrongful termination and a retaliatory discharge claim. So how do you deal with that? Well, if I give them without cause termination notice, they get to hang around for 90 days and poison my staff and be a pain in the ass. I don't want that. So what do? You sit down with them and you talk about it. You say, look, I've got two choices. I can let you go immediately for cause, which is going to be a dark mark on your record. And then when people call in for references, it's going to be a problem. Or we can make a deal to give you a little bit of time, or here's what I have in mind. What I have in mind is this. I'll pay you for 30 days. I'll give you a good letter of reference. And by the way, if you make that deal, what must you have every time? A release. Anytime you give something that you're not required to give, and you give it to the employee or the contractor in a termination scenario, the only way to make sure that you're going to be able to go to sleep and not wake up in a panic state is have a release where you never have to look over your shoulder to see what's happening with that client. They're not going to sue you. You're immune. You're not going to sue them. A general release. Pay money. You resolve the situation. You want it resolved. You don't want that door open. I didn't get into marketing a lot, but this is what I can download for you. Marketing is probably the most regulated place in healthcare right after healthcare fraud. Marketing. What does that mean? It means that how people get paid for generating business for any business at all, but especially pharmacy, lab, addiction treatment, those three, and DME, those industries in particular, the tip of the sword of regulatory enforcement is right in the marketing activity. your W-2 employed marketer or your 1099 contracted marketer. There are laws, the anti-kickback statute, the Stark Law, the Patient Brokering Act in particular. Those three laws in Florida are the things that are going to shape how you employ or engage marketers. And you basically have two choices: to get it right and to stay safe. One is a bona fide employee. This is in the materials, so you'll have it. Bona fide employee is really a bona fide employee. You exercise direction, supervision, control. The second is something called a PSA compliant arrangement, which is short for Personal Services Arrangement and Management Contract Safe Harbor. They all require that the relationship be specific in terms of what the services that will be required are, it be in writing, be in a contract of at least 12 months in duration, that compensation be set in advance consistent with fair market value. Those are basically the requirements. Here's the problem. Marketers like to be paid a success fee. They like to be paid commissions. Commissions and compliance with those laws come right into each other. There is a way to do that in a low risk way, but that analytic looks like this. There's a conversation about the laws, the options, and the risk of each option. What they're going to want is pure commission-based compensation. That's the highest risk option. The lowest risk option is a salary, and that doesn't make you or them happy because you're not rewarding for success. So you want successful outcomes, you have to explore what I call the continuum of compliance on that issue. And certain factors affect it. Is it a W-2? That's lower generally than a 1099. Is it largely flat fee, the compensation? That's a risk-reducing move. Is it largely incentive-based compensation, commission? That's a risk-enhancing move. So what we do on the phone or in person is we play with those issues and move you to your level of comfort in terms of the risk, and then we paper it up. Now, one other thing that makes sense to mention. When you've arrived at the proper contract that you want in that space, it's important that you not simply sign it, stick it on a shelf or in a folder. Why? Because the regulators have said many, many times in many cases, including cases that we've been involved in, you sign the contract, you look the other way, it's a sham agreement, and they'll prosecute you for that. So what isn't a sham agreement? A sham agreement is not one that you signed and one that you monitor compliance. One of the key ways that I like to do it is something called an attestation. So at least quarterly, you create a document that goes on the back of the contract that says, here are the 25 things I promised to do. Here's the 25 things I promised not to do. And every quarter, you attest, or they attest, I did the things I'm supposed to do, each one, click, 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 click. I avoided doing the things I'm not allowed to do, click, 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 sign and date. That's continuing compliance. It's evidence of compliance. It means to a regulator, you're not playing games. You're not just trying to cover up something illegal that you know is going on with a nice looking contract. Make sense? Avoid liability for sham arrangements by documenting something that mirrors continuing quality improvement or continuing compliance. So that's what the anti-kickback statute looks like for those of you who want to know what that is. Basically, if A is over here and B is over here, A is sending patients to B and B is sending money or something of value back to A. That's a classic kickback model. Does it mean that it's a violation if patients go here and money or something of value comes there? It does not. Why? Because there's a ton of exceptions. How many people have heard the term safe harbors? Great. So safe harbors are examples of commercial behavior involving money and patient flow, which is okay. It's okay. But you have to be compliant with those safe harbors in order to be confident that you didn't violate that law. We have another law in Florida called the Patient Brokering Act. And every state has weird laws, but Florida, California, and New York tend to have the weirdest laws in the healthcare space. So what happens with Florida is this law, anti-kickback statute, applies only to state or federal health care program. So this law would come to play when you're dealing with Medicare, Medicaid, Champus, TRICARE. So a lot of folks in your business say, you know what? Here's the good news. I'm IV hydration. I don't take Medicare, Medicaid, Champus, TRICARE. I don't have to worry about the anti-kickback statute. Here's the problem. Florida passes a law called the Patient Brokering Act, and it says the same thing as the anti-kickback statute. It doesn't differentiate on payer source, so it applies to self-pay patients, it applies to commercial pay patients, it applies to PIP patients, and what's the only home-based safe spot for the PBA? Bona fide employee exception or PSA compliant. So it then drops down all of the federal safe harbors and all of the federal regulations indirectly. Even though you're not dealing with Medicare, Medicaid, Champus, TRICARE, they treat you as though you are. So it's not true that if you're dealing only with a cash-based patient base, that you don't have to be worry about, comply with these federal laws, because they get you indirectly.
Jeff,
Yeah, man.
you've had extra time.
What's that?
Now your time's up.
Okay, that was it. Thanks, I'm here.
I wanted to make sure that Jeff showed that last.